Hi, do you have pain in your back that's worse when you stand for a period of time? Perhaps it's been going on for quite some time. You may have a condition called spondylolisthesis. Or maybe you've had an x-ray because of your back pain and you've been told you have a condition called spondylolisthesis and you're a bit concerned about it. I'm Anthony Ghosh, a consultant spinal neurosurgeon, and in this video I'm going to explain what spondylolisthesis is. I'm going to explain its causes and how we diagnose it. I'll briefly outline the treatment options, but I'm going to cover those in more detail in the second part to this video. In order to explain this, we first have to understand the different components of the spine, the anatomy of the spine. The spine is made up of a stack of bones called vertebrae, which are the building blocks of the spine. There are 7 in the neck area, the cervical spine, 12 in the chest or rib cage area, the thoracic spine, and another 5 in the lower back, the lumbar spine. And then below that we have 5 that are joined together in the sacral spine, then the tailbone. All of that segment is buried within the pelvis. Each block of bone is a cylindrical block with an arch of bone attached to the back. So here's the front, here's the back, and then they're joined together. They sit on top of each other, joined together with discs in between, which are little cushions. And then the arches at the back are joined or joined together by joints called facet joints. And then there are also ligaments that kind of strap these bones together. Now let's zoom in a little bit. So these facet joints here allow a little bit of movement between each bone. This is generally how we twist and bend and tilt side to side. But they also in that movement, they help prevent one bone slipping forward off of the other bone. But what happens if we get a lot of excessive wear of this joint, or even a defect, a breakage in the bone at the back? So spondylolisthesis is actually the movement, the forward or backward movement of one bone over the other. So if it moves forward because of a weakness of this joint, a failure of the joint or the ligaments that strap it together, we call that a degenerative spondylolisthesis. Here we have an x-ray of a patient with a spondylolisthesis. You can see this is the front and this is the back. These are the blocks of bone and these are the sort of arches at the back and the facet joints outlined here. This bone has moved forward, so we call that the spondylolisthesis. It's not in the correct alignment. And we can see in this case, it's not the facet joint, but there's a defect here where this crack is, this defect in the bone. And we call that an isthmic spondylolisthesis. So in isthmic spondylolisthesis, this sort of breakage in the bone here is a result of repetitive strain. It often happens at some point in adolescence or early adulthood. It's often seen in sports people where there's a repetitive strain, such as fast bowlers. But the actual onset of symptoms can often happen later than that, sometimes in 30s, 40s, or even in our 50s. Now here is an x-ray of a patient who has a degenerative spondylolisthesis. So again, we've got the front of the spine here, the back of the spine here. It's quite subtle, but you can probably appreciate that this square bone here sits ever so slightly forward relative to this bone here. There's a little step here, but there's no breakage at the back. The joint itself, the facet joint, has just become quite worn and overgrown, and it's weakened and it's slipped forward. Patients with a degenerative spondylolisthesis tend to be a little bit older, usually in my experience above the age of 60. And this is a result of excessive wear and tear of the spine, and there are multiple reasons for that. Often very sedentary lifestyles, so sitting for very prolonged periods of time, hours and hours a day, or sometimes just poor posture when doing certain movements like excessive bending and lifting. So how do we diagnose it? Well, firstly, it's the history and the examination. That's the most important part. And any tests we do thereafter are there to confirm it. So if you have back pain, that's often worse when you stand and weight bear. That's usually a sign. And sometimes bending forwards and trying to stand up straight, sort of forward and backwards movement of the spine can also aggravate it. There's often muscular referred pain to the buttock or the back of the thigh, but sometimes pain can radiate down the leg. So if we look at this diagram here again of the spine, we can see these yellow things here are the nerves that leave the spine at each level. Now if you imagine this bone slipping forward ever so slightly, this window, the channel through which this nerve leaves the spine, gets narrow and that nerve can get compressed, sending pain radiating down the leg. So how do we treat this? Well, I like to break it down into non-surgical management and surgical management, and I always try the non-surgical option first. In my experience, if I go through the images with a physiotherapist or an osteopath or someone that can give you a specific personalized exercise program to build a very specific group of muscles around that segment of the spine, that can often stabilize the segment and help prevent pain. If the exercises cause too much pain, then we can do injections into the spine that can just help alleviate that pain for a period of time, during which you can carry out the exercises a bit more effectively. Then if these measures fail, we can then consider surgery, and I generally use a minimally invasive option called a minimally invasive posterior lumbar fusion, where we place a little breeze block between the two bones, we realign them and put this bit of metalwork in to hold it all together, and that allows these bones over time to fuse together and stabilize. And I'm going to cover the treatment options, more specifically the surgical options, in a bit more detail in the second part of this video. I hope you found this video helpful. If you did, please click like and subscribe to the channel. And if you need any help or any information, please visit us at spinemdt.com. Thank you for watching.